And the final speaker before afternoon tea is Professor Swan Hood. Again, I'm not sure he needs a lot of introduction to this audience, and in fact this is his second talk this conference. Professor Swan Hood chairs a novel research collaboration with a Meeting for the Minds Foundation, which is a not-for-profit organisation dedicated to the research of the brain and disorders of the brain in partnership with people living with mental illness. Professor Hood is going to talk to us about the collaborative cross-institutional mental health related to COVID-19. Thank you.
Great, thanks Merrilee for that introduction. And knowing I was the last person in this particular session and I had 15 minutes allocated, my talk should take no more than 10 minutes, so that'll be a reassurance to many. Here's the pointer. And look, I think there's a natural progression for the talks that we've heard in this particular session, with Jeremy starting with, well, I heard at least 3 proverbial phrases. There was and then Chris followed up with the canary in the coal mine. I'm going to give you one today that relates to my talk, which is perhaps every cloud has a silver lining, because what we've seen from progressing from the very sobering data that Jeremy's given us about this disorder and long COVID, etc. And Chris's results with monitoring this in some populations, including the mining population, is that I've been really surprised over the last 12 months that an area in which I've been tearing my hair out, and as my son says, I've got a chrome dome at the top, so it's been a while. It is in terms of mental health collaboration in WA has always been a really challenging thing, and I think we've struggled to be a cohesive group. And one of the benefits of COVID has been actually that I'm seeing a level of collaboration, particularly in the mental health space, that I've not observed at all anywhere else. And this comes in a background of those of you who aren't involved with mental health research in particular may not be aware that traditionally, and particularly in Australia, and particularly in WA, I think we've fought over the same resources for many years. We've duplicated the work that we've been doing. I'm a psychiatrist, as you can probably tell from my Charles Gardner Hospital uniform. I'm on call at the moment. But I've got colleagues at UWA who are psychologists, and most of the population get us confused. The words sound pretty similar. Yet for my first 10 years working at UWA, I never had any real collaboration or meetings with my colleagues in the psychology department, which I think is pretty sad considering we're doing the same sorts of research on suicide prevention and other work. In fact, I'd be far more likely to be collaborating or reaching out to colleagues in Melbourne and Sydney and the UK than I was for people in Perth. And that's pretty sad considering the potential squandering of resources that we've had in terms of all working, ideally, hand on heart to better the population which we serve, but actually stumbling a lot. And this has led to a lot of unhealthy competition, I think. In fact, the way I used to find out what work was going on in my space in mental health research, largely, particularly locally, was when I was on, asked by national panels to review people's research and think, they're doing that down the road, or they're doing that here. That looks like a really good project. If only we could, break down some of the traditional inter-university and interdiscipline boundaries and start to work together. COVID as a disruptor really broke down some of these old ways of doing things. And in fact, some of the work I'm going to take you through really extrapolates from some of the stuff that Chris was just taking you through as well. So this all happened. This wasn't planned. COVID wasn't planned, at least that's what we believe. But certainly in 1 week last year in March, when we were all getting quite worried about this new disorder, this new disease, there was a flurry of email communications going on, and I'm sure some of you are in some of these, CC lists where one person sends it on and then there's about 20 other people and they send it on, and particularly when they're worried about these sort of conditions. I don't think a lot of people were vetting their emails and sort of restricting the communications. There were communications about what can we do in the mental health space, and to my long-term benefit, but initially just completely randomly, I said, well, perhaps we should meet and kind of discuss and see if we've got anything together, and people thought that was a great idea. And so a week later, we had a Zoom meeting number 1 on the 31st of that month. We're meeting weekly thereafter. We're reporting as a mental health COVID research panel, as a sort of sub-panel of the WHTN's research collaboration, and had a group of people working in the mental health space, which I think covers pretty much everyone in this state who's working in that area, or at least not them themselves. They are working or rubbing shoulders with everyone else who's really of significant research importance in this group. This is something I've been hoping to happen for many years, and I think part of the reason it did happen, it comes to a number of factors. And again, I'm a psychiatrist, not a psychologist, so I'm going to try not to use too many psychological reasons wrongly here. Obviously, the lockdown contributed a bit. People, apart from myself and those of you who are clinicians, who basically went to work and found that there was so much parking in the hospital parking lot, and you know, when you went to get some petrol, there were no queues. We all had to go to work every day, but most people were locked down at home, thinking, well, what can I do? How can I contribute? Of course, I've been using Zoom and similar things for many years, but Zoom became, you know, essentially a verb, and was really. Our students and the whole population started to consider how to work remotely, and Chris has just taken you through some of the long-term benefits, perhaps, of that in some of our companies in Perth, which meant that I didn't have to drive to Curtin or to ECU or to the country to have a meeting, but we could do it, you know, from virtually online in a way that was mutually acceptable, rather than seeing as being kind of weird or pushing some modern technology that no one else really wanted to be involved with. I think the key thing was, though, fear. This was, I see some relatively young people in the audience, and some junior doctors there as well. Well, this reminds me of September 11. You were very young back then, but for those of us who weren't, you know, this was one of the events that we knew at the time was going to really shake the world, and you know, the things were going to be different from that point onwards. And even though it wasn't such an abrupt event in COVID, it was more gradual. I think the fear of something different led to a lot of affiliative behaviours, people thinking, well, maybe we can throw away some of these old hang-ups we have about, you know, that other university down the road being evil and we being good, and start to kind of work with each other. And COVID really did disrupt this business as usual. And I'll take you through some of the things that we kind of did. And also, as you've heard probably all day, there's also been increased community awareness of COVID patients' impact on mental health. Jeremy took you through some of the potential biological reasons for that, but obviously there are long-term psychological contributors as well. It's quite a multimodal thing. But it doesn't surprise anyone if you say, well, you know, being locked up and not working and using Zoom all the day may have some negative impacts on your mental health. It's pretty obvious. Now, I don't expect you to be able to read, despite this big screen here, the list of collaborators on our panel on the left-hand side, but that's kind of the point. This is the group of people, 50-odd people, that were rocking up on Zoom every day. I think even Toby rocked up by mistake once. He's gone today, so I saw him here a little while back. But you know, this includes pretty much all the universities, so all the 5 universities from WA here. As you see, all the government, WA health services, including rural. We had consumers, carers, kids, ear science, pretty much a fantastic collaboration of groups of people in this research group who are all researchers in this space. And the point I wanted to ram home is that most of these people didn't previously communicate or talk to each other about the work they were doing. So I don't want to go into a great deal of detail. I want to focus on sort of big picture things today, but essentially we thought of a number of different streams and workforces that we wanted to explore, and resources. For instance, Peter McAvoy at Curtin really led our consolidation of mental health questionnaires. A lot of what we do in mental health involves taking questionnaires. We don't have many biological tests for psychological problems. But as you can imagine, say depression, there's probably about 15 to 20 questionnaires you could use for major depression. And we were thinking, well, let's decide on what the 2 or 3 main ones that we'd like to use would be, so that if we are studying, either as part of this group or separately, patients with COVID-related issues or issues relating to these conditions, that we can potentially combine and and cross-analyse the data because we're using the same sort of questionnaires and measures. And that's something we'd really never kind of thought about before and only really got access to after the papers were published. So Peter's been leading that. We've had a strong Indigenous component. The civic work, you've heard some of that just now from Chris. And look, civic had hit the ground running before we'd even started this collaboration. And we used civic as a bit of a golden child to sort of say, well, this is how things can be done. Let's collaborate even more broadly. We looked into digital telehealth, drugs and alcohol, some genetics, interventions, cognitions, and also surprisingly for me was a strong group of people who weren't involved in health or mental health, but a group of people who are involved in education, and this is like secondary, high schools, school teacher stress, student stress, headmaster stress, those sorts of things, and they've continued to be a big part of our collaboration. And this is another group, another boundary that we've not previously had a great deal to do with, unless you're a child and adolescent psychiatrist. Chris mentioned about ethics approvals. I wasn't sure how long it took you to get, this is one of yours, Chris, you can see your name on there, this for the civic study. And you said it took 8 days in total to get this sort of across the line. We had reciprocal agreements by the other universities, and you can see some of our names on there. I know at UWA, this particular one took 24 hours to get reciprocally approved. Like, I've been on ethics committees before. Normally these things take months, and that just shows the willingness of the community to kind of step up and the universities to kind of make this happen, which is just fantastic. It was really a can-do environment. So we're still continuing to have meetings, not weekly. We did apply for a round of sort of funding early on, which some of those were successful. Subsequently, I had a unique experience in my research career, which I don't expect to be duplicated anytime soon, which was I discovered I was the recipient of a significant grant relating to looking at COVID impacts of healthcare workers. But the interesting thing was that I didn't actually put an application in at all. I just heard from the university people that I got some money, and normally I hear, you put in this grant and there's been a 7% yield this year on, NHMRC, and unfortunately you didn't get it. This was, really the reverse. Even more interestingly, the sort of intellectual property of that particular grant really wasn't with me. It was with Elizabeth Needham at Curtin University. And so even though this is funded by, Jobs, Tourism, Science and Innovations particular grant, and I have governance responsibilities, Elizabeth is running the study from a operational point of view, and this is another example of a truly cross-faculty, cross-university project. So Elizabeth's running it, Peter is strongly involved. We have, as you see in the sheet there, from involvement from Royal Perth and from Murdoch and King Edward and Fiona Stanley, etc. And this is an ongoing research project where we've funded a couple of research offices, one of whom has an office near me and one has an office at Curtin, and I think this is a good example of the sort of ways that we can start to break down some of these boundaries. And look, I'm not a funder, but I'm thinking if I were someone from government or a significant funder, I'd be thinking, well, all these people historically have fought each other for this sort of small pot of money. Wouldn't it be better if they all got together and worked together, and we could say we could go to these guys and they're all playing well together, and we know that they're going to interdigitate well with health and with the communities, and hopefully it's a more attractive sort of destination. We have an ongoing resource which is sort of there for people to use really, which is cross-disciplinary, cross-university, cross-health service, urban, rural, researchers, clinicians, community groups, people with lived experience. Basically, it's as broad as you can get, I think. And so that's what I want you to leave you with. We've heard a lot this afternoon about some of the really significant negative aspects of this COVID-19, but every cloud maybe, sometimes at least, has a silver lining. Thanks for listening with me.
Are there any questions for Professor Hood before we go for afternoon tea? If there are not, I think it's a great note to leave us on, thanks Sean, that every cloud does have a silver lining, over and above just getting ethics through in 8 days. I thought at SMARS we were fantastic getting them through in about 10, but we got beaten today perhaps by Curtin on 8 days. That's phenomenal. And getting a grant with no application, that's also a silver lining. But I think, and what I hope you've all heard through every single talk today, is the benefits of collaboration through COVID-19. the power of researchers all aiming towards a common goal. And the common goal is that of improving patient care as well as population health, both physical and mental. So please join me in hoping and praying that we can continue these collaborations going forward and building up research and innovation in WA.